technically we're getting there almost now. And I think everybody that has to be here, or is going to be here, is here. So let's call the roll.
Okay. Commissioner Henning.
Here.
Commissioner Miller. Commissioner Schneider.
Here.
Commissioner Zender.
Okay, Commissioner Miller has agreed to say the prayer, and we'll ask Mr. Schneider to lead us in the pledge.
Heavenly Father, we thank you for bringing us all here today. We thank you for the rain. We thank you for the day. And we thank you for giving us the opportunity to live in such a country. Today we ask you to provide us with wisdom and wise counsel as we deal with the issues that are at the Lapeer County Commission level. We ask that you fill our minds with knowledge and with peace as we deal with these issues. I also ask you to lay your hand of peace upon people in this county who may be going and struggling, and on the world as a whole. Say this all in your name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, looking at the agenda, you have one addition, something got left off that we agreed to talk about. That was the nominations appearance process, where we have a motion that says everybody has to appear. We're going to talk about that. So if you add that under, let's make that what?
9D?
9D?
Yeah.
Okay. Any other topics to be added?
I'll move the agenda with that addition.
Support. We have motion support for the discussion. Seeing none, those in favor say aye.
Aye.
Those opposed, no. Okay, thank you. And the minutes from September 29th meeting.
I'll support.
Any corrections for discussion? Seeing none, those in favor say aye.
Aye.
Those opposed, no. Yeah, we do have a folder passing around here on budget, travel, whatever. It'll be coming around to the let me know if it doesn't get to you. All right, department heads, updates from departments. Any that we've got several that will be on the agenda. Doesn't mean you may not have something to update, of course, but any department head want to update it? Not seeing any, then we'll go to public time. Any members of the public that would like to share their 3 minutes with us? Morning.
Always a pleasure to share with you. 3 minutes or a little more. Alan Pierce, Hagley Township. Coming before you all today, as we normally do, and just to keep it in everybody's mind, and to try to be some kind of persons that have been doing their research. Now we're sharing that research. Answers to the top 10 most common election integrity questions. How could there be fraud when all lawsuits were dismissed? There's been no election fraud lawsuits heard. They've been dismissed before they were even heard because the complainants waited too long. The candidates don't have standing. And the injury has not occurred yet. That was the reason for all these lawsuits so far to be dismissed. I think there was there was probably some fraud, but was it really enough to have made a difference? We don't know because no checks have been made. The question back to those people would be, what amount of fraud would be acceptable to you if you think that there might have been fraud? We don't have Dominion voting systems in our county, state, so why should I worry about election integrity? We do have some counties in this state that do not have Dominion, but that doesn't matter. The vulnerabilities and problems in our election system aren't limited to one voting system vendor. Doesn't the human error in hand counting have a higher error rate than machine counting? No. Machine error rates range from 0, unverifiable, to 100%. Election officials simply are not in control of the machines. They are corruptible. My clerk, Secretary of State, party leaders said our machines aren't connected to the internet. Not one of those individuals has the slightest idea what is or is not inside a voting machine, nor what any component or software in a voting machine is doing, any more than they know what's happening on their own smartphone. Inside each Dominion voting machine, which is what we use in our county, does have a device inside that can connect to the internet without any connection whatsoever. All it needs is a Wi-Fi. Somebody can do that from their phone. Would a dumb tabulator be safer? Not unless it's an abacus. There's more information. Won't it cost a lot more to hand count ballots than to use tabulator machines? No, essentially you're asking, will it cost more to count an election in a manner that people can trust? Don't we need to know the outcomes of the election night, on election night? I heard hand counting will take weeks to complete, plus a lot of manpower. If you had to choose, wouldn't you prefer accurate election results to fast election results? One more thing. If everything about our election system is as bad as you say, why should I bother voting at all? Because fraud becomes more difficult when we vote in person on election day on a proper ballot with ID. I have copies of for each one of you individuals. I will leave it with you. It's got all of the data to back it all up and exactly where I got it from.
Thank you.
Ready, set?
Tell me when, Carol.
Good morning. While I still have breath, I shall use it to come before you. A couple different things going along with the election proposal that they want to change all these election rules. Want to get rid of ID. Let's just get rid of showing our ID. And it's interesting because there's a whole list of things that we need IDs for. We need a valid ID to drive, board an airplane, purchase a car, get a car registration, rent a car, boat, jet ski, buy insurance, buying train tickets, obtaining a passport, picking up mail from FedEx, renting tools, visiting a doctor's office, getting outpatient testing, donating blood, getting a prescription, buying a certain over-the-counter cold medications, applying for a job. And the list goes on and on. There are, I don't even know how many, but we could all add our own that we've been asked for our ID. And one thing that even goes along with this, kids don't even need an ID to read pornography in school. Yep, that's my issue. But we need an ID to do these other things. Another thing is the Conic Corporation, where the CEO has been arrested by LA. Well, come to find out, not only are our counties using Conic, or the city of Detroit used Conic, but also schools are using Conic. So Conic actually has sent our students' information over to China. And that's why some people come up here, and I know different people have questioned like the internet thing with the universities and why are we going this way and all of that. And then we've asked other people, well, you're going to adopt this app or you're going to use this app. Where's that app really coming from? Who, are they just giving you an app that you put on your phone, but there's no connectivity to China or anywhere else? I don't think so. I think we need to start questioning where all of these apps are are coming from. Our township last night had a, not even discussion during the meeting, but before the meeting about, they're gonna have a meeting with someone that, is going to show them one of these texting apps where they can send out texts when there's meetings. And it's like, where's that app coming from? You know, we're gonna pay attention, because I'm not gonna give them my information if that text or if that app is not completely, it's not connected to anyone else. The last thing, with this proposal 3, Governor Whitmer has come out with, well, and I think there's already this program called Plan First, but she's come out, she's gonna give tons of money in she thinks in 2023 when she thinks she's gonna be governor again, tons of money to MDHHS, and it encourages women and families to plan first. Well, if we planned first, we wouldn't need all this push for abortion. We wouldn't need that. And I know how some of you feel, and thank God you feel that way. But proposal 3 is lethal.
Thank you. Further comments? Okay, seeing none, then we'll move on to the agenda, which is full of items and contracts. And first is community corrections. Steve will ask to come forward, go over those. Again, maybe a little more background than you might present, because we do have a couple of commissioners elect in the audience. Give them a little start on understanding it too.
Okay. Morning, everyone.
Morning, Dick.
The first contract on the agenda is the contract between Thumb Regional Community Corrections and AICC, which is Alcohol Information and Counseling Services. The programs that the Community Corrections is going to fund is substance abuse, Thinking Matters, and intensive outpatient, formerly DHR, which is a drunk driving program. Any questions on that, or how much background do you want me to give?
Well, to help the process, I would move A, B, C, and D, which are specific providers that we use to provide services, and allow Dave to focus mostly on E, which is just an overview of what community corrections is, how we do that regionally, and the fact that we do an annual budget every year, we can kind of do a little 5-minute summary on that, and then we can move to approve that. But I would move A, B, C, and D, the provider contracts.
Support.
Okay, so you're recommending the full discussion?
On E,
Okay, that's fine. We get it there unless any discussion about the specific items before that in terms of programs. I do have a question. Some of these programs, just, I guess I would ask where they're cited, like career directions, their offices.
That actual program either happens via Zoom, or the provider travels to the jail or another location to get it.
Do they have a headquarters
No,
as such?
no.
Health Department, no, list psychological services?
Their main hub is in Tuscola. They have offices other places. Moving forward, they may start to do some things in Huron County. We just picked up Huron County as part of the region for fiscal year 2023. Right now, the only program slated in Huron County is the opiate non-specific program. That program is held at TRICAP, which is located in Sagerville.
TRICAP? That's one I don't know.
It's a residential facility. They do have other programs that they provide there. They contract with the state, MDOC for a 90+ program, which is a 90-day residential program for like a broad substance abuse program. Community corrections, we provide the opiate meth specific program. We pay for the counseling part of it. MDOC pays for room and board, the per diem part of it. We got lucky that they allowed the region to participate with that program. Originally, it was Bay, Saginaw, and Midland, Tri-County. That's how it started. We were lucky, reached out to the grant coordinator because Lapeer, it was just Lapeer and Tuscola back then. Lapeer was having this significant issue with opiates, so we bought into that program. It's a 150-day program, provides basically everything that person needs. Not only counseling, they get medical care. They were given, and they still do give the COVID vaccine, dental work, you name it. Basically, they're for almost 6 months. Any need they need is taken care of. So it's a good program.
And you mentioned it being a good program. My other question was, how do we evaluate these services that we're contracting with? Most of them we've been with a while, so how do you evaluate their effectiveness as programmers?
The state requires two things. One, that all the programs pass an evidence-based practice level. So the provider, that's more provider stuff. So the programs they use, like Thinking Matters, developed by 8 Friends, which that Thinking Matters program has been going on for a long time, way before my time. The state, the program description is evaluated by the state, saying it's evidence-based practice, along with the IOP program, the substance abuse program that is held at LIST, AICC, the opiate-specific program, which one of the grant coordinators helped develop. It has to be evidence-based practice. The other threshold they now make us look at is, does the program work? Each CCAB has to come up with what we're going to use. Thumb Regional decided we would look at everyone that completes the program successfully for a 12-month period. Do they reoffend? So we take each individual, a reporter that completed the program, and we look them all up through Judicial Warehouse and the probation department's help as well to see if the people that completed picked up a new offense. If they did, then we consider that the program didn't work. It was a failure. The exception is the employment program. We look at that one 12 months out, 6 months out, I should say, then 12 months out. Did they gain employment? Background on that program, some people that have a bad day and end up with a felony charge, they may be a doctor, they could be a chiropractor, have a skilled job that now that felony becomes a barrier to their employment. That program teaches them ways to explain that without, obviously you don't want to lie about it, but explain that away, how to get the employer to accept them back. That's how that program works. So we look at, are they employed in 6 months and then 12 months? That's a success on that program. So that's what we look at as far as doing programs work.
Good answers. Good
Now, if
question.
I could add in one other comment, which is going to segue then into what Dave talking a little bit more about community corrections under E, is there's probably, I can't think of, in my 20 years, any activity that is probably more scrutinized in exactly that question that you asked about effectiveness than the aspect of community corrections. You have an advisory group board, which, because our community corrections is regional and involves several counties, we have several counties that are represented by sheriff's department and their corrections staff, state probation and parole, prosecutors, law enforcement, the judges, all the way through the aspect of community corrections. And they meet to discuss numbers and programs and costs and effectiveness. And then at the end of the day, this is the state's effort in passing some of these dollars onto local governments. Their main effort is to try and keep a lot of these offenders from reaching the prison. So it's the Department of Corrections that's giving these dollars. Community corrections is a part of that. And like Dave said, they've transitioned over years to everything being evidence-based. So if you want your dollars, you need to be able to prove to the state the effectiveness from a numerical evidence-based standard, every one of these programs. And so it's discussed openly by all the different stakeholders. How are we doing compared to other areas of the state, community corrections? What do we foresee the state doing with this program, with this initiative? So it's a very holistic review that takes place in the community corrections environment.
Correct. So the other thing, if we're moving on to the actual grant, there's much more.
Well, we won't move on to
Yeah,
that.
let's
We
stick
want to
with
vote on on A through D first.
on the contracts.
So let me say one thing then about the contract. So the question is, how do people get in programming? Okay, so it's eligibility criteria for the people to get into these programs. So first, they have to either be an adjudicated felon or a sentenced felon. That's the big one. Misdemeanors are something that we can't fund. It's either adjudicated. I'm not going to try to get too complicated. Some judges like to do, if they can be complete probation, it'll drop down to a misdemeanor. So that's what we consider. They were charged with a felony. It was adjudicated as a felony, but they're not sentenced as a felon. So we were able to, through some work with the state, it used to be just sentenced felons. Now we can do felons who are adjudicated as a felon and under MDOC probation supervision. So how it works is at the time of sentencing, a PSI report's done by the probation agents. The judge has that in front of them. The probation agents, as well as myself and my staff, help prepare that with the eligibility criteria for each program. And on that PSI should be which programs they are eligible for. So at the time of sentencing, the judge has that, can look at it and say, you're going to do substance abuse, you're going to do Thinking Matters, or the IOP program. After the time of sentencing, it comes back to my office. We then again check for eligibility because we do get audited every year. If it's found that we put someone in a program, I paid for it, and then they weren't eligible, that's not good. So it's pretty time consuming, but that's what the state wants, and they're the ones holding the check, so that's what we have to do. So.
Okay.
Any other questions?
So you're saying with all of A through D, you're satisfied with the vendors and
Yes.
are encourage us to approve the contract?
Yes, all the vendors, to be honest with you, the last couple of years has been very difficult. Things have changed from in person to a lot of it being via Zoom. There's good and bad to that. As we've all heard the topic of internet lately. There's some people who don't have internet signal or cell phone signal where they live, so Zoom doesn't really help them, or whatever video device they're trying to use to get with programming. But it has helped in other ways. The other thing with community corrections is you have to have 3 people. They want everything to be a group. That's just what the state wants. So we have one person in Huron County, one in Sand Lac, one in Lapeer. If we're doing it by some video conferencing, there's your group of 3. So, but yes, all the contractors have, I can't say enough good things about them.
Okay, thank you. Question?
So with all these TARCAP programs and stuff like that, I realize a lot of different moving parts in this, the Thinking Matters program and whatnot.
Brian, could you maybe talk more towards your microphone, please?
How many people in Lapeer County in a given year are taking advantage and using these programs?
It varies by program. Right off the top of my head, I can tell you we put about 60 people through in Lapeer County. We're just getting the data for the full year all done. I think it was 60 for Thinking Matters, 40 some for substance abuse. In the IOP, I don't have that data for Lapeer County. Because the end of the month, they have till October 10th to get us the data, so I'm still crunching that data for the full year.
Okay.
I can tell you how the numbers come up is we set a number that we hope to obtain. So whether it's 60 for Thinking Matters, 40 for substance abuse, 24 for IOP. We set these numbers, and that's how we come up with the money.
And one of the other things you can do for the commissioners, just give them a copy of your latest annual report that we do every year to the board that will list all the numbers broken down by each individual county for all the different programs.
Sure,
He
so our
does
next,
have- So that's an example, when you're looking for quantitative numbers, like we've talked about in the past, they've got exactly what you're looking for there, because that's all stuff that has to go to the state, and that's what the state is looking for too, so they have plenty of.
yeah, our next board meeting is the 27th of October, and that's when we'll do our year end, and then the final report goes to the state. But if you want to stop by the office, I have all the numbers through August.
No, that's fine, David. I just like to say, I just want to make sure that, we're not spending this kind of money for two people,
So
these
that's,
programs.
yep, so that's a great question. So, and I'm not gonna point the finger at him, but gentleman in the back row, Todd Engelbrandt, he's the, is the AICC director, and he's the one that would make sure that we're not double dipping in Lapeer, okay? The state frowns on that. The issue becomes with that double dipping is, so each insurance company says they're the payer of last resort, right? So Medicare is not kidding, okay? So, and Todd knows way more on this than I do, but if Medicaid was billed and community corrections is also eligible to pay for that program, then that would be a problem. So it's really up to not so much me, but the actual provider to make sure they're not double dipping, if that makes sense. Okay, they would be, so someone walks into the office, first thing, list psychological, or Todd's gonna do is go, okay, is this a community corrections program? Are they eligible for that? Or am I gonna have to use some other funding source? Whether it's Region 10 dollars, Medicare dollars, they have private insurance. That's a provider deal. My thing is I need to make sure that if I'm paying for it, they're eligible. Because I have to put every single person, I should say my office has to put every single person that we put through a program in a database that the state can see. In that database is literally the eligibility criteria. So they could literally look it up and go, wow, this person wasn't eligible and we paid for it.
And just to be clear, you're only reimbursed in effect for what your services are. So if there are two people, you get one amount. If there are 60, you get a different amount.
It depends on the program. So Thinking Matters pays by the group, okay? So they pay $90 for a group of 3 or more up to 8. You get $90, it's for the group. Substance abuse is different. They pay by the person, as well as the opiate not specific program pays by the person. Although they do have groups, but it basically breaks down you're paying for the person, and so does substance abuse. So when they do an intake, there's a fee for the intake, there's a fee for the group per person. So you still have to have the group, but Thinking Matters is a different animal. It's paid for by the group. Bigger the
It's
group,
stipulated in the contract.
yes.
Okay, any other questions on the programs before we go to maybe any other general questions? Seeing none, all those in favor of A through D contracts, say aye. Aye. Those opposed, no. Okay, E, you want to put a motion on the floor and then we'll discuss?
Sure, I'll move E and they answer question given out to you.
Support. Motion to support.
So again, this is a renewal of the 2022 grant. It's the same amount. Worth noting, it pays just over $4,000 in cost allocations. That's it. The state's not going to give us any more for cost allocations. At some point, I see that in the past it did go away. I was able to get that small amount back, but the state's not into paying cost allocations. So again, it's checked that they do allow it, but it's just that one small amount is all they're going to pay. The other thing worth noting as far as admin, the state allows up to 30% to be billed back for administration, which includes salaries, chargebacks, mileage, meals for the meetings, supplies, equipment, but that's only up to 30%. Again, it's just a renewal of the 2022 grant with the difference being we added Huron County this year, which hopefully bringing them on board will bring more people in, more people that we, or defenders, I should say, that we can provide programming to. The more money we spend, if we spend it all, I could ask for more. And, you know, the more money, the better. It's about helping the people in the end, but we have to have the money to help them.
We're the fiduciary, but TARCAP represents how many counties?
4 counties, it's Lapeer, Tuscola, Sand Lake, and Huron. And
That
Lapeer.
stands for Thumb Area Community Correction Advisory Board. And virtually all of the advisory boards are regional in this program across the state. There was a period of time in which, so they've talked about a couple of them, like Huron and Sand like that, gave up and said, we don't want to do this process. And they have since worked their way and tried to come back into the fold now. And it's a win-win for us because Dave explained the numbers game, for example. But some of the counties that left community corrections found that even though it's state dollars, and so the state sets the rules, at the end of the day, it still helps serve some of your citizens. I think we've had the sheriff's department come and talk before about all the programming that they have. You have a captive audience, you know, while they're locked up. You know, you want to try and turn their lives around and release them back to a community where they're going to be successful. And so the state is looking at recidivism from numbers and trying to keep people out of prisons. We're just looking at when the judges are sentencing these people, trying to do the right thing and have as many different programs available that they can offer for people that are getting sentenced. So yeah, our regional community corrections now has grown to, we brought a couple other counties back in. And I'll just say this one other thing before we end up taking a vote. Dave has done such a tremendous job leading the helm on this, because not only do you have to have a really great deal of expertise working with all of these different aspects and stakeholders of something like community corrections, but it's as much about personal relationships when you're dealing with the state. We've had our times in the past where we've had people that did not play well over at the state level. And those difficult people, which aren't there anymore, but those difficult people, Dave, when he came on board, was able to right the ship and make things right. So he's got a great way of working, not only with the numbers, but working with people and all the various stakeholders, including the state. I just want to give him and his staff, I want to give them recognition for that.
Thank you for that.
Should I ask administration, at one point we were putting county money into this community corrections, partly.
It's mostly cost allocation. Cost allocation because the program, we charge the program for the cost allocation like we do every grant, but the state doesn't reimburse us the cost allocation.
So the problem we had in the past, partly the description that I think Commissioner Snyder was talking about, partly also that they had such fixed categories for how you could spend money, those problems have decreased or gone away.
Yeah, they still have their silos.
So they
A
do.
little bit more flexible.
They still have their silos. The problem in the past was, the big one is the drunk driving program, which we now call intensive outpatient, was a separate funding source from all the other programs, which are CPS, is what it's called, programs. I actually was one of the managers that went and lobbied in Lansing and said, can we please get rid of this silo for back then DDJR, because we're not spending all the money. You've allocated me money, giving me more than I wanted, but I can't spend it because it has to be a OWI third, drunk driving third, for me to use this money. They since have gotten away with that. It took a little bit. They first said if they're an OWI third, you can pay for substance abuse or thinking matters with these dollars. It just was crazy. It was a nightmare trying to juggle everything, and they finally got away with that. There's one fund now. That's one of the reasons why we had to call it IOP, intensive outpatient, instead of DDGR, because that funding source has gone away. What it did is it freed up more money across the board for all the programs. It allows the board, because the board is the boss, so I asked them, can we move this money around? Let's say one program runs out of money, the state, as long as the board approves it, it's much easier to take money that I was allocating for Thinking Matters or another program and put it to a program that we're overutilizing, which overutilizing is a good thing. Historically, in the past, prior to me taking over, if we overutilized, an email or a phone call went over to the provider and said, hey, stop spending the money. Now we have the ability to go, look, I've got this extra money, I'm underutilizing this program, I can just move it into the other program. And the state is allowing that as long as the board approves it. So it's been a long journey, but it's the state is getting easier to work with. I'm not saying it's super easy, but the channels of communication are more open than they were in the past. Again, they're the ones holding the checkbook, so they're setting the rules we have to follow.
Just to clarify, one thing came up in the question. My assumption has been that the Lapeer County people who are participating in this are not currently incarcerated when they're doing that. Is that correct?
Sometimes they are. That's one of the nice
Okay.
things about community corrections funding. Some funding sources are not allowed to be used if you're incarcerated. Community corrections is not one of them. So while they're incarcerated, again, as Mr. Snyder said, we have a captive audience. So if we can get a provider in there to the jail and give them the program and then the incentives for them to complete the program, even though they're a captive audience, they get credit for jail time. For instance, in Lapeer County, if you complete substance abuse while you're in there, you get 4 days credit. If you complete Thinking Matters, you get 3 days credit. So if they complete them both while they're in there, that's 7 days off their sentence. It's an initiative for them to participate, and at the same time, we're providing them with the program.
So some are incarcerated, some are not.
Some are not. If they don't finish the program while incarcerated, then we move it to the community and we continue to fund it out in the community. So we've got it going on both ways. So, and again, that's where Zoom has helped out because you can run both, incarcerated and incarcerated at the same time, as long as the jails have that capability. Unfortunately, some jails do not. Lapeer does. Sand Lake does. I'm not sure about Huron because they just came on board. Tuscola does not. Their jail just doesn't have the room or the manpower to watch somebody. So they're working on it.
Okay, any other questions from the board about our current motion accepting the grant? See none, all those in favor say aye.
Aye.
Those opposed, no.
And I saved my update since I knew I was coming up here for a bit. So, as Commissioner Snyder talked about the advisory board, historically, the way we handled the advisory board is when the county came on, such we brought Sand Lake in, we just added a sheriff, we added a prosecutor, we added everybody. So each county had one of everything. So I had 4 sheriffs, 4 prosecutors. The board got to a point where it was enormous without Huron County being brought on board. The last meeting we had, which was here, we had a very difficult time making quorum. I get it. It's 4 counties. It's quite a drive, hour and something drive for some people. So at our last advisory board meeting, we decided that what we would do is restructure the board and still in accordance with PA 511, but what the act requires as far as a membership board is that we have 1 county commissioner from each county. After that, we only have to have 1 sheriff, 1 prosecutor, so on and so forth. So that's, as a board, we decided to do that. Those nominations will also take place at the next meeting. What we're hoping to do is to get a advisory board that is more active and we can make quorum and it's not just people voting to, pass a quarterly report. They're being more active. The other thing we discussed is term limits. Is it going to be 1 year, 2 years? But again, I work for the board. They tell me what they want to do, and then I make it happen. And I want to thank Commissioner Snyder for the support he's given community corrections. I know prior to my time, he even at least once went to Lansing and talked on my behalf, or community corrections behalf. You will be missed. moving forward, since you're the one, hopefully, when the new board gets here, we are gonna need a new commissioner, on the advisory board. I think November 9th is when they're all coming in. So I'll give a little spiel of what we're expecting. It is a commissioner and or their designee that has to show up. It's gonna be 4 meetings. The next meeting, we will vote where it's gonna be. Again, it'll be up to the board to decide. Sand Lak's kind of in the middle, or do we go to all 4 counties to make it fair for everybody? But that's for the future. That's what we're looking for, just to get more participation. So, any questions on that? Well, thank you.
Thank you for the extra explanation. Hopefully that's helpful to our incoming board members that
I
are.
look forward to working with them, and like I said, fortunately, unfortunately, however you want to say it, community corrections is a complicated thing, because you have all the players, you've got the state, you've got 4 different counties now, multiple providers. It's just an evolving, animal that is hard to tame at times. Thank you.
Thank you. Just to double check, can the audience hear? Nobody is raising their hand or waving to indicate that the microphone wasn't working, but we're coming through basically back there.
Yes, sir.
Thank you. Thanks to the board for your patience on that. We'll go on then to number 4, Health Department AICC.
I'll move that.
I'll support.
Okay, and we've got Todd here. Let's bring him up.
Morning, Commissioners.
You want to give a quick background on this?
Quick background on the regional PIHP. It originally started as the Thumb Alliance. It was 3 counties. It was Lapeer, Sand Lak, and St. Clair. Maybe a dozen years ago, they added Genesee, so we're a 4-county region. Region 10 manages all of the Medicaid dollars and what they call block grants, so those are funds set aside for folks that don't have insurance, and they manage what we call prevention dollars. So prevention dollars are used for programs prior to somebody getting a diagnosis and being in treatment. So we look at anger management, parenting classes. We're in 3 different schools right now, working with kids, trying to work through some of those behavioral classroom issues and getting back to some of that true prevention work. We also go out and do vendor education with retailers with tobacco and alcohol and try to target some of that universal prevention, helping store owners and clerks understand what a driver's license looks like under the age of 21, how it's more portrait versus landscape, and helping them not sell tobacco and alcohol to youth. So that's kind of the short background on the Region 10 and how they manage those funds for us in the community.
The amount of the contract?
The treatment contract, I'm not sure, it's a fee for service. So the more people come in, the more we can reimburse for Medicaid and block grant. I think our prevention contract was about the same as last year, about $116,000. And there's also one in there for the naloxone, the Narcan trainings that we're going to try to ramp up and do this year. And that was maybe around $22,000. And that one too is when we provide, we get reimbursed. So it's not all and then you bill back to it.
Any other questions from the board?
I'll just make a comment. I've heard great things from AICC Lapeer, so
Thank
good
you.
job.
Exactly what I was gonna say. Here's another unsung hero for us here who's been contributing to Lapeer County for a long time and definitely knows his field.
Starting my 23rd year.
Yes, thank you, Todd.
So Todd, when you talk about the Narcan training, who would you be training to?
A lot of that is community based. So we've had some fire halls or volunteer firemen or other local community members come in and try to do some quick trainings. I've just been bogged down during COVID, being at a health department, getting told different ways to help cover some of those clinics. So we haven't had a big rollout of that program. One of the things I've been trying to do is get a regular time, couple times a month, to start working with community mental health. They're working with an agency out of Genesee County to provide some of those trainings. So I'm gonna try to get back doing that, and then we're gonna have kind of at least one standing meeting where anybody that wants to come can get that training. It's about an hour and a half. Just a basic how to deploy the nasal spray, some real basic CPR and a little bit of paperwork. And then we send them out with a box of Narcan that's got 2 doses in it. And if they use that, then they can come back in and we can get that reported to the state and we can give them a fresh 2 doses. Or if that expires, I order more from the state, so that's at no cost to the county. And we can have a supply on hand for folks.
So this is more for like individuals or like said firefighters?
Firefighters, we're gonna be working with some of the school districts to get them retrained, churches, parishes, any business, anybody or any resident in this region that wants that training can get it. It's easier to do with a small group, but I can carve out an hour and a half during the day and make that happen because of the end result. We're trying to, prevent that overdose. So that's a well-spent hour and a half.
Thank you.
I read or heard somewhere that Narcan itself was getting used so much that there were, at least in that area, there were some problems with supply. Is that an issue for us here?
That is not an issue. I've got maybe 100 doses on hand, so we can make sure we can roll out efficiently come end of this month into November. So after that first training, I'm going to go ahead and reorder, so that way we've got a stock with that expiration date far enough out in the future that I'm not worried about it.
Do we have a rough idea how many doses get administered?
I don't. There is a mechanism at the state that I'm going to be getting brought into to look at overdoses and how many saves there are, but I couldn't guess, short of trying to get with medical examiners and look at that. I'm sure the numbers are there. It's just trying to find who's the keeper of those numbers.
Okay, any other questions? Seeing none, all those in favor of approving this contract, say aye.
Aye.
Those opposed, no. Thank you.
Commissioner.
We now have friend of the court, number 5, Ian Joseph.
I'll move this one as well. Good morning, Commissioners.
And very brief overview.
Yep, I'm here in front of you to request acceptance of fiscal year 2023 access and visitation contract. It's a renewal from last year's contract. In this case, it would start at $2,000, and hopefully throughout the remainder of the fiscal year, we'll have an opportunity to increase that. But this would provide for supervised visitation of individuals and being paid by the state. Examples obviously would include parents who have substance abuse that can't be trusted, supervising their children, and have disagreement with the other partner, and they can't come to an agreement as to what third party utilize. This provides an avenue where we can use an organization such as KIND, Kids in Right Directions, to supervise it, and this provides funding to the state to pay for it if the individuals are unable to pay for it themselves.
So these are supervised visits between typically one parent and their children.
Correct. And we get hung up all the time about parents, but at the end of the day, we're here to try to do what's best for the children. And despite what mistakes mom or dad may have made in the past, this provides a safe avenue to that parenting time between the child and their mom or dad.
Any other questions about I think we have a motion. Do we have a motion? Okay. Any other questions? Seeing none, all those in favor say aye.
Aye.
Opposed, no.
Thank you all very much.
Thank you.
Equalization. Here we go. Morning.
Good morning.
Good morning.
You're going to need to speak loudly into that microphone.
All right.
Thank you.
Today we are requesting approval of the revised L 4029. The revision is to add the law enforcement millage that was passed on August 2nd.
I'll move it.
Support.
Should note, as we talk about this, by adding this, we're increasing the amount of taxes that our citizens are paying. We still will be ranked very low in terms of our basic millage rate. But when we add in now with this additional millage, total millage from all sources will go to another position that I don't know, but evidently was somewhere in the middle of the pack.
Just so we're clear on this, this is what the voters.
I was just gonna
have
say,
decided.
you need to
It's
define
not-
we
it's
is not
not
Board of
us.
Commissioners, we is the majority of people.
Thank you for being very clear with that. Yes. But as we go out and talk, as commissioners think about their money, no longer can we say that both of our rates are now among the very few lowest in the county, so.
Well, the discussion always revolves around.
Special,
Exactly.
they have special purposes, they're tied very specifically.
So we will be on the low end of general villages, and we'll be middle of the pack on special.
Something new for all of the commissioners to deal with. Okay, we have, I believe, a motion and a second. Any questions about what's occurring or the amounts or anything? Seeing none, all those in favor say aye.
Aye.
Those opposed, no. And then 6B,
I'll move that.
Support.
Okay, this is the final apportionment report, which is presented in compliance with Michigan compiled laws. And its adoption shall be the total tax levy for 2022. We've received the required 4029 from each taxing jurisdiction. It complies with the state constitution. These forms are reviewed and verified by our office to ensure that the millage reduction fractions were applied correctly. Any changes by legislation or election to occur after the state, adjustments will be needed to this apportionment report.
any major changes in how those rates have increased or decreased?
Nothing, I think, that I've seen. I believe, there's 4 that are coming up for election in November, so there is a possibility we'll be back to revise this.
Just.
Any further questions? All those in favor say aye.
Aye.
Those opposed, no.
Thank you.
Okay, on to number 7. I'll invite Jeff Sadowski to come forward. We've got a resolution that's being presented in our packets.
Morning.
Oh. Any comments?
So this resolution is a requirement of Act 390, the emergency management law, to apply for reimbursement of costs incurred during a water emergency. So what this does is get our foot in the door for reimbursement, and based on population of the affected areas, you can request up to a certain dollar amount. For Lapeer County, that's going to be $250,000. So this resolution is asking for up to $250,000. We're not going to have that much to put in, but in the weird event that we do find, hey, we did spend, $249,000, this resolution puts us in a position to get up to that amount. So that's a requirement in order to get this, and that's what the resolution does. I will be meeting with the Health Department and Road Commission within the next week, because we have a scheduled meeting, not tomorrow, but next Friday, with the state finance person to submit all the paperwork for reimbursement, and this resolution will go with that paperwork. And then the state will look it all over. She's gonna look it over with us that day and say, we got everything done right, looks good, we'll send it in, and then everything should be good. So that's what this will be for.
All right, this is only reimbursement to governmental units
Correct.
of any level,
Correct.
any type.
Yes. Yep, so the county, what we're doing is for the health department and the road commission here. Road commission is not their own political subdivision, they fall under us, obviously, as you guys know. So that's what we're doing. Elmont Village has to do their own resolution, Emily City has to do their own resolution, and then we're all gonna be meeting next week.
Would it include school districts?
No.
Question?
So Jeff, basically this reimburses like the road commission for the expense of going and hauling that water and stuff like that.
Potentially. It gets a little tricky, as she was explaining to us in the meeting with the road commission, because they have restricted funds, and there's a certain act that they fall under, which allows and disallows certain expenses to be put in. But in the general answer to your question is yes. But there's fine print in there that some stuff may or may not be allowed,
Of course.
as always. Just like the phrase up to, you know, you get up to $250,000, but you're only gonna get this.
So what about the cost? Because obviously you have quite a lot of water that needs to be picked up and redistributed or wherever it's gonna go. So are those potential costs in this as well?
To deal with what's left over right now?
Yeah.
Not likely, because I don't foresee any of our governmental entities expending any further money to do that. So the water that's sitting there now, anybody, I sent out the note, any municipality that wants any is responsible to go get it. It's on them. And then the state's gonna come and pick it all up and take it wherever they're gonna take it.
Oh, the state is actually gonna pick it up?
They're going to, yeah. But we have nowhere to keep it all. We can keep it all if we want.
Right, but where do you put it?
Where are we gonna put it? We don't,
Right.
as a county, we don't have any facilities that are gonna keep it from freezing and storage and all that stuff. It'd be nice if we did, and the water, believe it or not, does have an expiration of like 2 years on it, so. But we're free to keep all or some of it. I do have a few fire departments that are going to take some cases, they're not gonna take a full pallet, because they don't have anywhere to keep it either.
Has the state already paid for that water, or is that part of the reimbursement process?
The reimbursement is for us. The state has already paid for it, to the best of my knowledge, you know, because distributors that produce it, they want their money now. So,
Makes sense. Okay, we need a motion and a second, I believe so.
I will make a motion.
second.
Motion and a second, and roll call this point or next meeting?
Both. You
Either.
can do it now, but it will be required next week. So whatever you choose.
Our practice has been recently, we just
Just
do
pass.
the vote now and then just read it into the record.
Okay.
Only if you have authority.
Oh, that's right, today's committee of health, I'm sorry. And we might as well just move it to next week.
Okay, I'll take that as the motion.
And that, there's another unsung hero, always keeping us on track.
Okay, we do have a motion and second. Hopefully the original motion maker and the second agree to that. Further discussion? Seeing none, those in favor say aye.
Aye.
Those opposed, no.
Thank you.
Thank you, Chad. Okay, another grant, 8A. We have somebody from the sheriff's office that's going to be dealing with this, road patrol.
I'll speak to that. Sheriff McKenna and I spoke yesterday, also conferred with Susan Baldwin, and they wanted clarification to accept. There was question about how many years the renewal of the 416 Secondary Road Patrol grant was in effect. It is in fact the 44th year. This would be the 45th renewal of that grant. So this is completely standard. Everything is on the up and up. And so they're simply asking for a renewal to continue on for what has been going on for 44 years.
Support.
My understanding would be, Jackie Arnold may want to add or correct that the amount here, the $57,350 is the, might say the first amount that's approved from the state.
Correct.
we know that legislation has been passed that will increase that amount.
Correct.
So we're going to see this again, but this approves our initial amount. Older board members will remember how much over the years this has declined in terms of the state percentage of what they paid for this, to the point where we've been paying for more than one of the deputies ourselves for a number of years now. There will be some relief, at least for the coming year. What we know by the legislation. We'll see what happens after that. Okay, do we have a motion? We have a motion and a second. Any further discussion? Those in favor say aye.
Aye.
Those opposed, no. It's passed. And back 8B for the sheriff. Lieutenant Beebe's here. We have the independent contractor agreement for healthcare services. We got a draft motion to look at. You want to explain this? Because this is brand new.
Correct, and it is brand new. And currently, what we have right now is, we have a doctor, but we don't have any, it's a handshake. So if he calls me tomorrow and says, I don't want to do it no more, I have a doctor. And that's kind of a problem. And so really, this is designed to protect the county and the jail and the sheriff's department and everybody, but we actually have a doctor in place for the term of contract, under those terms.
I will move it.
Support. Okay, questions?
Well, I know this has been an ongoing issue, right? Trying to find someone permanent.
Yeah.
So, I mean, as much as I'm not a fan of independent contractors with this, I think this is one time where we tried it the other way and the other way just doesn't work. So I think it's a good idea.
And just so you guys all know, I want to tell you the scrutiny I put this contract under. First, I went to Mr. Bishop for his approval, then I went to corporate counsel. Then from corporate counsel, I went to risk management, back down to corporate counsel, back down to Mr. Bishop, back over to corporate counsel for approval.
So that's a thorough process that we would hope, especially on new agreements. About the selection for the doctors in the past, who in the past actually selected the doctor?
Whoever we could find. Whoever was willing to take on the inmate client.
But who did that? Was that the
Well, Dr.
sheriff?
Khan did it. Or
No, not the doctor, but whose authority is it to hire?
we found it. We did.
The sheriff's
Yeah.
office.
Yes.
So in effect, the sheriff has been responsible.
Yes.
Just has not been a written agreement.
Correct. No, it hasn't been.
Termination area has a good thing to have 30-day termination. Then it says this agreement may terminate at any time only when both parties stipulate to the termination of right. So does that mean then that 30-day part that needs that stipulation? Or is it in case you want to do it even quicker than 30 days, both parties agree?
Correct.
So it could be quicker than 30 days,
Both sign off.
as long as both parties agree.
Say if everyone's in agreement on how it works, I'm assuming that'd be okay.
Okay.
As long as both parties are agreeable to it, whatever that may be.
But the 30-day termination is not required, does not require stipulation. If there's a disagreement.
Let me pull it up real quick.
That's 14, number 14.
Number 14. Either party may unilaterally terminate this contract anytime provided another party. Sure, yeah, so what it's calling out is that either party can terminate the contract with written notice.
Right.
Okay, and it's saying we need 30 days notice. We need a month heads up that's gonna happen. And if it to go into effect, we just need to have evidence that both parties have it in writing that this is what we're agreeing. So It's saying that last sentence is what you're calling out. The agreement may terminate at any time, only when both parties stipulate to termination in writing. So if the doctor says, I would like to terminate my contract, that doctor needs to give us 30 days notice. If the doctor and the county come together in a meeting and say, this is not working out, and we both agree that we should be terminating contracts, put it in writing that we both agree, and it's in lieu of the 30-day notice. So the 30-day notice protects the county because it doesn't allow the doctor to walk off the job. Okay.
What happens when the county gives the 30 days, the sheriff gives 30 days, but the doctor sort of disputes that or disagrees with it?
It's 30 days. It says that in the first sentence. Either party may unilaterally. The not meeting the 30 days only applies to when both parties agree to it. If one party is saying, I am going to terminate the relationship, 30 days notice is required.
As long as that's clear to everybody. It
Well,
just
just so you're
seems
aware.
clear to me.
Well, yeah, but currently what we have is no notice. He could call me right now today and
Right.
say I'm leaving.
No, I understand the 30 days for both
So right now we
parties.
have no notice.
It's just the way that stipulation part happened.
Quite frankly, the 30-day notice would come, the less than 30-day notice would come into effect if there was some malfeasance, there was a problem. And we just said, hey, this is an issue. We both agree to terminate. That's what that's saying we can do. It's protecting us. So if we say this is not working out in this relationship and the doctor realizes this is not working out, it allows us to expedite the 30-day notice. I can guarantee that the sheriff, if that was the case, the entire sheriff's department, they would have a plan B lined up if they were going to terminate before 30 days. Because if not, they would exercise, if not, they would exercise the 30-day right, and then they would be able to fill it within 30 days.
Okay, as long as that's clear. To me, it was confusing.
No,
Yes.
it is clear, and it doesn't have to be exclusively malfeasance. That would be an excellent example. But
That's just
another
one example.
would be is when it's mutually acceptable to both parties. We're gonna waive this 30 days. Doctor says, for this reason, and I've got Dr. So-and-so lined up, and we say, well, not only is Dr. So-and-so acceptable, but we've already vetted this doctor. Boom. But if both agree to waive the 30
No
days,
problem.
that's the reason for that last sentence. Otherwise, it's a 30-day. If either party wants 30 days, it's 30 days.
Correct.
Okay. I would probably rate that just slightly different. The other question, 2 years contract versus 1 year. Reason for 2 years being,
This is the number they came up with. No specific reason. It just was 2 years. 1 year, they get in there for a year, they wouldn't even have
Exactly.
time to even get anything, make any of the changes they want to make.
Yeah.
It's gonna take them a month just to understand the process.
and make it maybe a little bit more of something that a doctor would want to take on, because a year does go pretty fast for them. That'll change their
I mean, 'cause a year
practice
is
substantially.
Essentially 12 visits to that jail.
Are they on call?
Yes.
So if their inmate health issue, they might have to go there more often.
Yeah, that's their decision.
Okay.
Whatever they tell us to do, what we do. They want to come, they want to go to the office, they send them urgent care, ER, that's their call.
Their call. Any other questions? Okay, now, do we have a motion? We do have a motion. A second? All those in favor say aye.
Aye.
Those opposed, no. Gentlemen, you've been-
Thank you.
Thank you.
Thanks for working so thoroughly on that.
Sure, well, I figured I would participate in your question.
Okay, 9A,
I'll move that.
nice simple one.
Support.
Further discussion? All those in favor say aye.
Aye.
Those opposed, no.
9B takes a little bit of explanation.
Yep. 9B does.
Come to the podium for this one.
For your time. This was a proposal to not only discuss, but I think that
this would be the time to ask some appropriate questions about what we're proposing. In a nutshell, finance, human resources, myself, met with our third-party administrator, Doug Stacks, to talk about our healthcare coverage. Also in the room at that time was representatives from McLaren, as we historically has used McLaren for healthcare. To say that it was a challenging conversation. I would not say it was the most friendly conversation, because we had some very difficult questions to ask and we demanded very specific answers. They presented us with a package which covers our medical insurance, life insurance, dental vision's built into the plan, and for our employees, correct. And at the end of the day, they came back with a percentage that I thought was grossly overvalued, and I challenged that. And so the bids, we have received quite a few bids. I know that speaks to what you were, Commissioner Miller, what you were asking for. And at the end of the day, one package did not have enough in-network physicians in the immediate area to provide for the service, so they were not a really viable option. We even had Blue Cross Blue Shield come to the table and to discuss, except that they had not submitted, after a month's notice, a medical quote. They had quoted dental and vision, but they did not quote medical. And to this hour, I checked this morning before I came down, they had yet to submit a medical quote. So here we stood with McLaren, and they had proposed a percentage increase that I said was unacceptable. And I challenged that. So when that happens, they go and they need to sharpen their pencil, and then they come back to the table, and they did. And they came back with what originally was going to be a 14.6% increase. And at that moment, we stopped the conversation. I'll speak very frankly about how the conversation went. I said, a 14.6% increase on health insurance alone, in that single act, will completely undo what we have worked for the past year to increase wages for our employees. So we increase wages in one hand, it sets morale, it makes us market competitive, it adds to attraction initiatives, it adds to our retention initiatives, and then we take it right away because insurance premiums go up. This is completely unacceptable, and I said we have to do better. So they come back to the table and they said, okay, we found their quote unquote wiggle room. They found that they could deduct 5%. Okay, you deducted 5%, now we're at 9.6% increase. Okay, so we're still left with a dilemma. We have a 9.6% healthcare increase. I still think that is unreasonable to charge back to our employees for their contribution, because it's going to ultimately go back to them having to pay for more insurance for essentially the same quality. So paying more, receiving the same. So this is my proposal. We do have the ability to choose our own way. Right now, we operate, and it is under a hard cap. And so essentially what it means is that the state of Michigan says to a municipality, you are allowed, if you choose the hard cap route, and there's three routes. There's a hard cap route, an 80-20 route, and a self-funded route. We are under a hard cap route. What that means is that the state tells you a number that you can contribute to an employee's health care. It is X. That increase on the hard cap, it's a little bit of an increase on the hard cap this next year, does not equal the 9.6% increase. So we have a delta. Who covers the cost? Typically, we pass that on to the employee. And that is what I think is wrong, because in passing it on to the employee in this case, we're doing away with what we worked for, increased wages. Okay, so the hard cap route I don't like. So they had the second route, which is the 80-20 rule. When we pencil the numbers, which we did, we penciled the numbers. Right now, under the hard cap, we cover 83%. So the people who work the numbers have realized that if we give you a hard cap that's more than the 80%, you would never choose 80%. Why? Because you're getting less than the hard cap. So it still plays in favor of the state, the hard cap. But we don't like the hard cap. So we have a third option. So it's through Public Act 152. There is a an opting out process. It's an annual exemption, and you can do it, it's annual, it's not permanent, it's not perpetuity. It's an annual exemption, and it says that you will choose your own way and you will pay the amount that you would like to pay for healthcare insurance, healthcare. And this is my proposal. I would like to see that we pay for that increase in health insurance. So our people will be paying the same amount for the same coverage that they're used to. So in effect, they can anticipate that the increases that they see in their wage study goes to their pocket and not to healthcare premiums that they may or may not use. Okay? What does it require? It requires a resolution by this board. I know that this is committee of the whole, and this is up purely for discussion, and a final vote cannot be made. And I would strongly encourage if we can have Ms. Jarvis and or Mr. Warren here. I know Mr. Roy will not be here till November. It does require a 2/3 vote of the governing body. We have 57% here represented today. We need one more. And if we can't have that, we will then be placed back into the hard cap route, which will increase expenses, and we only can pay at so much. I'm strongly encouraging that we go for this annual exemption. Okay, that's just me talking. Let's talk about real numbers. How do we afford it? Let's go to the next question. Where does the money come from? We are sufficiently funded in the Internal Service Fund for healthcare insurance. We have an estimated 2-month expense of $831,000 and some change. $831,000. We're sufficiently funded today in the tune of $1.9 million. Okay. So how does it happen? So we have employee contributions as revenue. That's what the employee pays for that particular fund. Okay. We have a chargeback account that we, and it's a blended version. It's not just simple. Jackie reminds me, she goes, "You just like to simplify things." I said, "For my brain, that's how I work." But she says, "You have to understand that the chargeback account accompanies more than just health insurance." So when you see that line, right, chargebacks is more than just health insurance. But we have expenses, right? We have McLaren health insurance, we have other health insurance, and our ending fund balance, if we did nothing else, would be $2 million. Why is that a problem? Why is this a problem? Because even though we're charging a 4% increase, and we're budgeted for 4% increases along the way that we go, okay? As McLaren rolls up their account, we just roll that out to historically, you roll that out to the employee. You budget X, and then anything above that, it gets rolled down. What I'm saying is stop the rolling down because as we increase that fund balance, right, it sits there. We're sufficiently funded. The auditors tell us that we need 2 months of expenses. That's $831,000. If we continue at this pace, we're going to be pushing at this point 20%, 25%. There's no need for it at this point. We have the opportunity to cover the cost for our employees by giving them that raise that we worked for without deducting because of healthcare insurance. We have the monies to do that, and it's in Fund 678. It's the Internal Service Fund. The money is there. Okay. As an aside, and you say, okay, well, how much is it for? Okay, so it's really going to the house. It's going to cost the house about $400,000. Okay, to cover those overages
per year.
An extra $400,000.
Correct. With the annual exemption, I'm talking a 1-year term. So we go back to, you go to McLaren and you shop it out, you get the Blues to actually do what they're going to do, and you don't get hit with a 10%. You do 7%, so that decreases at 400,000. But you have to remember, though, as soon as we charge that amount, right? So there's other areas of grants that can cover it, right? 4D can cover part of it. Healthcare can, the health department covers some of it. CMH will be covering some of it. So it's all part of that blended model. That some of those can be spread. Some of those costs can be spread out. Okay, but think about it in terms of it's $400,000 per year. Okay, we're rolling up though. We're rolling up that fund balance in the tune. I'm looking here. The tune. We're pushing 450, 500,000. There's 250,000. Okay, we're covering the cost. Okay, this is a direct cost. This is a deduction from our account. It is. It absolutely is. But it covers the cost instead of rolling it back to the employees who would see the wage increase and have it directly taken away for the same amount of coverage. Okay. In terms of the resolution that I proposed, which is in the packet, I've taken this example. We have modified it, rewritten it for the county of Lapeer. I've had general counsel look at it, and I've had the thumbs up from general counsel that it passes muster. All the necessary language is there. As I said before, it's required of a 2/3 vote of governing body, and we do not have that today. But I'd like to bring it up for discussion purposes and to provide for next week, hopefully we can have the necessary amount of board members.
This, we're talking about actually for 2023 budget. That's
Correct.
the authority we're giving them. So
Correct. Timing is important as well because open enrollment's coming in soon. I know Cheryl Sims was saying here, she'd say, couldn't get this done because she needs to roll this out to the employees and they need to be able to make decisions on their healthcare for 2023.
Any questions for Quentin?
Well, I was actually gonna say, maybe, considering how big of a deal this is, I don't know if we wanna think about this, maybe talk to Quentin offline, because this is gonna probably get pretty detailed, I gotta assume. So maybe, you know what I'm saying, like, this is gonna be a very detailed question and answer period with you back and forth. Questions aren't gonna be able to be answered right on the dot right now for some of the fund numbers. So what I was saying is maybe we move this to next week, commissioners can individually talk to Quentin and get some of the
Our
questions
process
done.
would be, this is committee of
And
the
I think
whole,
that
so
would-
it would go to next
Yeah,
week.
that's exactly what it is.
My point is, I just didn't want to have a bunch of conversations that, one, Quentin can't answer right now because he probably didn't have all the numbers off the top of his head. And that he might. But two, we probably don't have all the questions we want to have just yet either.
That's why we have committee of the whole,
I know.
full
So
board.
I just wanted to throw that out there.
For the new commissioners elect, that's one of the big advantages of doing this in a 2-meeting session. You have some time to think and question.
It's unfortunate that we have to play by the rules of somebody else. And in this case, we'll play by the rules.
So I'll make the motion to move it to next week.
Okay, we're moving the topic. And again, as reminded, we're gonna need 5 votes.
I'll support, hopefully you can send out
For-
emails and try to get one more member here
Well,
for next week.
Linda should be here next week.
Hopefully, we'll have 5 next week.
Good Lord willing.
We don't need 5 to move the topic, so we're in good parliamentary order here. Any further discussion? I would say it's still appropriate to ask questions. If people have them now.
Without making a specific question, I'll make a comment instead. I think, and most of the board felt when we were going and coming out the Great Recession, and the state came up with the hard cap and came up with the 80/20. Us being a board that represents a very conservative community,
Commissioner, can you talk in your microphone?
we were in support of a hard cap because it was some type of way of making sure that government just didn't continue to spend money without scrutiny. But fast forward a decade later, it doesn't take into account certain circumstances. Like we all talked about Proposition A and Headley and going way back when. Those pieces of legislation were well intended to be able to protect our residents and have conservative tax policies, but it never took into consideration what happened in the Great Recession when all of a sudden communities lost 30% of their value, and now your tax base can only grow by the CPI or maximum of a couple percent, and it's forecast out that it took us over just to be able to break out of that hole. So you always find things along the way. We're even going to be examining a simple motion that we made recently, appointments to boards. And then you have some unforeseen consequences come up and you need to be able to tweak those things. I think this is one more example of the hard cap in 80/20 is good for all of those communities that have spent high on their employees' wages. A very conservative community like Lapeer that has always spent a lot less, and now we find ourselves in a position, like you say, where we are so drastically under the market that we have to do a wage study just to bring people back up. This legislation, this hard cap, introduced by the state and accepted by our board, like a lot of other boards, didn't take into account then the situation that we have now. And I firmly agree with what you say, that if we recognize the fact that we need to bring the salaries up to a level that retains good people and hopefully attracts some that were leaving, we won't be able to accomplish that if we turn around and have to spend a large amount of money, or the employees rather have to spend a large amount of money. So I for one, fully support your recommendation. I think it's wise to be looking at that bigger picture. Workforce is where the services are provided to the community. It's where the rubber meets the road. That needs to be what our focus is on. And if we find obstacles along the way like this, then we have to make tweaks and adjustments. So where I supported the initiative way back then, we look to now 2022 with 2023 lenses on and beyond. I for one support your recommendation.
Thank you.
Any other comments or questions from the board? If not, I think we have a motion to move the topic to next week. Any further discussion? Okay, seeing none, all those in favor say aye.
Aye.
Those opposed? Thank you. Again, we got homework to do that for the succeeding week. Administration also has a C here for jumpstarts. Either administrator or chief financial officer, you want to
My steps in.
help us with this?
Do you really think you were gonna get up that easy?
I was like, sweat's already pouring, so it's,
Yeah, because we didn't do them last year, before last year.
there we go. So, let me get caught up here, sorry. So the post-employment healthcare savings plan, occasionally we jumpstart eligible employees. It's based on their years of service. And what that allows to do is that a portion of money is deposited into employees' post-employment healthcare savings plan. You have to be about, you have to, I don't know the exact year, you have to help me here.
It's 10 years.
So you're vested, and at that point, these monies, you start earning monies based on your longevity that goes into this healthcare savings account, okay? Every employee right now from day one actually has money going into it. About 30, well, it is $30 a month. And it's put into their healthcare savings plan, put into healthcare every single month, $30. And the goal is, it's an incentive bonus. It's for retirement, right? And so when you retire, because we do not pay long-term healthcare costs,
That's the important part.
That's the-
I was hoping
that's
you
the
were going
point.
to explain, unlike those jurisdictions that we've said, that post-healthcare that they provide that causes such a legacy cost to governments.
this is the reason.
We do not provide, again, being a very conservative board, we've not done that. We've tried to just come up with something that helps the employees when they retire have a little bit of a nest egg to be able to pay for deductibles and things of that nature, but not for the government entity to incur the large legacy cost of post-healthcare insurance.
Yeah, so mostly if they don't have a spouse, if they're single or both spouses have left the workforce and they're using the marketplace for their insurance coverages, we anticipate you could be anywhere from a few $100s to a couple $1,000 depending on your health at the time of retirement. And so it extends their benefit, their healthcare benefit, by something that they've already earned. It's not something that's coming out of our pocket. We've already paid it forward and put it into their account. But every now and then what happens is we have these funds, and it's a jump start. It's basically taking the years of service that they've had times the amount of money per month, and that amount is put into the employee's healthcare savings account. So when they retire, they have to retire from Lapeer County to access those, right? That they have that and be able to use it. For those employees who leave us early, and so for example, an employee 5 years in, 6 years in is not vested, we still put in that money, okay? But if they leave at 6 years and 7 years or 8 years, that money's brought back into the county pool. It's only after you're vested before you become eligible. So what finance department has put before you is the various, I would call it employee categories, right? You have general, non-union, appointed department heads, elected officials, so on and forth. And then you have the represented employees, and these are our bargaining units. You'll see Teamsters, this is police. You have, I don't see, oh, there's ASME here. You have what each individual department would then receive from their bargaining unit for their employee set. So I don't have a total here. I apologize, we can total that up.
$321,460 approximately.
Yes.
That's the number. So that that investment would go into the healthcare savings account as a whole.
Again, the big incentive is to try to retain employees long term.
Correct.
Yes, yep, it's about retention. In the short term, it immediately helps those who are in a retirement window. So if you're in a retirement window and you'll be extracting your retirement benefit from the county, Jumpstarts, it would be there as just a boost. I mean, this is additional monies for those who are leaving the county and they're going to be accessing that healthcare savings account.
Jackie, so somebody who has been here for 30 years, what kind of money does that person have in their healthcare savings account right now?
Because we've been doing the jump starts for so long, they're going to have approximately $80,000.
So that's their healthcare
Yeah,
insurance.
but then somebody that's only been here 20 years has only got $20,000. Hence why we need to continue the jump starts to get them up to where the 30-year person is. The 20-year person has only been getting $360 a year, plus a little bit of jump start. The people that have been here for 30 years have been getting those jump starts every year. So they have a little bit more than what the 20-year person has. And the theory behind that was we started jump starts 21 years ago. Well, they've already been here for 10 years and didn't get that $30 deposited every month. So they needed those jump starts to get them caught up with the people that were going to receive the $360 annually, from their hire date. It's not enough. That's what it is. I'll tell you that.
And again,
It's not enough.
to use the discussion just prior that the administrator had about the cost of health insurance. Can you imagine if we had employees that were retiring, a large
The objective
force of
is,
retired people
yes.
that we were paying their health care every year for
Yeah.
all of their years? The post-employment fixed amount is a much
yes.
less cost to the county.
And the majority of this, Brian, will be funded by our pooled money at Alaris, which is, Alaris is the company that MERS contracts with to administer this program. So we have a bank account with them where all those forfeited funds throughout the years resides. And the majority of this jumpstart will come out of that pooled fund. It's not going to come out of the county's, internal service fund.
So that fund, what other things could that money be used for?
Nothing. Healthcare savings plans. We can't get it back.
So it can't be used for the additional healthcare costs.
Not to my knowledge. Once it goes to MERS, you can't bring it back.
And you say the majority of that,
Last time I looked at that bank balance, there was about $245,000 in there.
Okay.
And what you did, 320 is the total.
so there's still.
We have a sufficient fund balance in the internal service fund for the healthcare savings plan.
Okay, that's some discussion. I don't think we have a motion yet.
I did have a quick question. Is this in lieu of the stipend?
No.
Is the stipend on here?
It's not on the agenda.
No, and this is my concern is, we want to do all these wonderful things, okay, but And obviously, this one, I guess, if the money's earmarked and that it truly can't be used for anything else, then this makes sense.
Yeah, well,
That's true.
Or,
just,
or we wait until there's actually enough money in that fund, you know, whether that takes a year or two or whatever the magic number is, and then do it to cover the full thing.
So, just so I understand, I think I got this in my head correctly. So, we have a bank account of $270,000, let's say. It's all money that would have gone to somebody who would have been here for 10 years, but they forfeited, so it's money that we cannot use for anything else. So
Correct.
instead, we're just reinvesting that money that's just gonna sit there and
Yep.
can't be used for anything else back into employees who stayed
Correct.
as a jump start. And we're
Correct.
gonna have to add 50 to 60,000 of internal funds to balance that out.
Correct. We have sufficient funds in our internal service fund to cover that.
Okay, and the reason I asked about the stipend, because there was some confusion on my end, because I actually asked, and I think there was a little bit of misunderstanding. So this is not in lieu of it, this is potentially in addition to it, and this is just to jumpstart the employees.
It's something that we've done, yeah,
That's-
we've done the jump starts annually for a number of years.
Just wanted to clarify all that.
This is redistribution of funds. Brendan, this is your money that you had in your healthcare savings plan that you will not be able to take with you, so.
We're gonna give it to somebody else.
Redistribute it.
Exactly.
Unless he comes back.
Does it work like that?
No, yeah, it's
I
gotta be
know, I have to
continuous
start
service.
over.
It has to be continuous?
It has
Yes.
to be continuous, yeah, I have to start over again. Never do that.
So it is truly your money.
Okay, is there a motion?
No,
Is there a motion from the
I'll
board?
make the motion since it's my money.
Okay, motion.
I'll support Brendan's money.
Okay, further discussion. Seeing none, all those in favor say aye.
Aye.
Those opposed, no. Again, we do have a week if you have further thoughts. I detect that we're gonna have another topic at some point on stipends.
Yeah, I
Some
thought kind of
point.
maybe on this one.
Yes, we are.
How did we miss?
We already had the motion.
Well, I was actually gonna ask.
Well, we have the stipends we did. We set the motion. We did the motion a long, long time ago, and I brought it down with me.
The motion was in March 10th, and the motion authorizes the stipend. The only thing that needs to be decided by this board is the amount and the day.
So we said we had to wait until
Budget.
budget.
Yeah.
Right.
Middle of review it right now.
That's what I was
Right.
gonna ask, do we want to,
I think there was
I don't know
a
if
to
we
be
can
done
do
by.
this right now, but if we can make a motion right now to move that topic to next week to get that done and over with, because I know,
I think we
don't
need
a
more
motion,
time
we
on
just
that.
instruct.
well, I think,
We need to authorize an amount, and it's by,
November 18th.
yeah,
We have-
November 18th.
exactly.
So so really what has to happen is this governing body needs to choose the amount, and then we need to
Yeah,
authorize it.
so my question is, and this is a calendar question, so this is committee of the whole, this is committee of the whole, next COW is what date?
27th of October.
And then the following would be November 10th. So,
For committee of the
Third.
whole.
yeah,
Oh, the whole or?
so our next committee of the whole is what? Say that one more time for me.
The next committee of the whole is October 27th,
Okay, and then the next board after that, where the thing would be officially decided, would be the
3rd.
third. Okay. Would it make more sense to wait until that committee of the whole to bring that on? Is that enough time? If we put that in committee of the whole on October 27th, and then it gets approved on the 3rd, is that enough time for administration to get everything done by the 17th as requested in the motion?
Yeah, the check wouldn't be cut until that
Okay,
following Friday, which is fine because we're gonna have open enrollment, the chaos of that with Cheryl.
well,
So
in that case, I will.
Why not do it next week, Brendan?
Well, I agree, but there's some issues with bringing it next week. There's some commissioners who want more time on it. I'm okay bringing it next week, but I just wanted to be
I'd just like to see
lenient. That's all.
where we are with budget, a little more detail.
I'm okay.
So-
No.
If you brought it next week, you could forward it with wording to act to the next committee.
Let's do that.
Well, in that case, I'll make that motion then,
I'll support that.
Okay, let me read.
To avoid
for the topic to move
the
to next
topic.
week.
Topic,
So we have a motion to move the topic to full board next week. Further discussion. See none, those in favor say aye.
Aye.
Those opposed, no. Okay, the topic we added, the nomination appearance issue. I don't know if we were asking for a copy of the motion that we put in place.
Oh,
Doreen was gonna
Doreen
try
was
to
looking
send it.
for it and she has not found it.
It was sent or established recently.
I told her it was in the last 3 months. Didn't you think it was in the last 3 months?
Well, in that case, do we want to move this to next week then? So we, I'll make that motion.
Well, next week we'll have authority. Next week we'll have authority. So just,
That's true.
if administration will just remember to get that, and if the clerk can put that on the agenda for next week, then we'll at least have a chance to review it and tweak that language.
And just to add, we have at least one nomination that's come to for us to consider for the EMAC board, so somebody that we know pretty well.
Some sucker that nobody knows.
Well, saying, so, what is that policy we want to have? Okay, so those in favor of the motion,
there was
Oh,
just,
wait, we don't need
Oh.
one.
that was a consensus.
it was a consensus, okay. Gee, I didn't know we did things like that.
Oh, yeah, you do all kinds of things.
You just always look at the boss over there, so let me share that.
She didn't flag me, so I didn't.
When-
All right.
Yes, that's my favorite one.
Biannual budget update.
Budget update? Well, we're still working with the department heads, like the document that I gave you last week, it's changed. It's changed. And I don't know how many, do you know how many hearings we've got scheduled?
Just over 4, I think.
Four, I think, yeah, he's right, there's 4, and I think the one is just an informative, it's the clerk hopped on, because she wants just to inform certain things, upcoming things to you guys, information.
Well, I'll share with you then also, I had a conversation with our vice chair, and then I had a conversation with our administrative controller. The one thing that we need, and I appreciate it being emailed to all of us to give us more time to do it, is it's hard to look at the numbers without a sheet of assumptions. Which
Okay,
is the process that we've always
Okay.
gone through.
okay,
So it's very common for you guys to be having those assumptions. We need to know what they
Okay.
were. This factors in X, unestimated X cost for health
Okay.
insurance. This factors in X number of dollars for a wage increase.
okay,
This does or doesn't factor in the wage study, and if it does, here's just the amount that we plugged in. This factors in the millage, and this is how we're gonna, so
okay,
email us, she has
I will do that.
assumptions, and that'll help us
absolutely.
sharpen our pencils.
And I'm still working on the projected year-to-date for the current year with the September numbers. I have August numbers, but I wanted to wait till I had September numbers firm, because why wouldn't I? It's October 13th.
Okay, so we're now, again, being reminded we need to protect all of October 20th. That
Yeah, I
meeting
think so.
And hearings, and
Mhm.
probably not, but potentially might have something on Friday the 21st spillover, so. Morning, at least. Normally, if we have that, probably morning would be the logical time.
To the best of my knowledge, that we don't have any yet, so, but yeah, I would say.
Before we can probably handle it, unless we have a very, very long. Okay, we do have several committee meetings. I'll remind the board, we have personnel properties, I believe. Right? Okay, and ARPA after this. So we have, I think, unless I'm missing something, we have one more portion, our public time. Am I missing anything else before we go to public time? Okay, if not, then open again to public time. We noticed some young people in the back. We're glad to have them. Hopefully, some of this made some sense. It's something you're going to hear a lot more about in the coming year.
I assume they're here supporting Dad, and about right now, the conversation on the way back is gonna be, you decided to do this, why?
Looks like they're here under duress.
Yeah, thank you.
It's going to be a complicated job, but you can help them through it. Okay, I see no comments from the public. So with that, we have no closed session, and we can adjourn this meeting. I have to get this right. We adjourn this meeting, just not the full board. Second? Okay, adjourn.
So
Which
now
I
we
have,
have
but
to.
I think it's in the documentation right here.
Three of us on personnel.
Did they adjourn or not?
Yeah,
Did they adjourn?